Robert Lowe. Hello, everybody. This is Dr. Robert Lowe, pediatric rheumatology here in Las Vegas. This afternoon, I'd like to talk to you about something that you've probably heard a lot about in the past, but weren't quite sure exactly what it was. Growing pains. What are they, and does it matter if your child's diagnosed with this? So we're going to go on and answer some questions from people about growing pains.
Okay, do you want to start off by explaining what growing pains are?
So growing pains are actually a shorter term. They've been around for a long, long time. They're the medical description, which isn't that cool or easy to say, is non-inflammatory musculoskeletal pain in children who are growing. But that's kind of a mouthful. So growing pains is the term that we use. And something you should know is that it's actually a misnomer, meaning the name actually is incorrect. These are pains, and they are in children, but when kids get these are not when they're growing at their maximum velocity. So we start out with a name that's a little bit misleading. And so to go on from that, growing pains are essentially pains that kids can have at any time during their childhood that involves basically if pain that is usually at night. It can be very frightening for both the child and the parents because the child can wake up screaming in pain, and they usually indicate that there's pain somewhere in their legs, not usually right on the joints, but anywhere in their legs. And generally just a massage or some Tylenol or ibuprofen is enough to get the child to go back to sleep. But this can be a problem if this happens frequently. Real growing pains, you should not have any abnormalities in any of the blood work. And that's not to say that you necessarily need to go get blood work in order to exclude it. But it does mean that there can't be anything obviously in causing these pains, such as a red or swollen joint, or one joint that's larger than the other joint, or a leg length difference. When these other things are present, or a fever or a rash, you need to consider what other things could be causing pain in a child. These other things may or may not be something that's autoimmune or rheumatologic. That is something that a pediatric rheumatologist is best suited to evaluate and determine whether or not there's any evidence of the immune system attacking the child's legs or their joints that may be causing autoimmune disease. The problem with growing pains is that quite frequently physicians through the years have used it as what we call a garbage can diagnosis. Garbage can diagnosis is basically you don't know what it is, but it sort of has something to do with a certain area. So a lot of times kids that complain of any joint pain, a physician would look at them and say, no, you look fine to me, probably just growing pains. And the problem with that is that you do need a careful examination of the patient, a physical exam to look and make sure there's no swelling, rashes, any signs of inflammation, tenderness, and any other differences that would suggest that it's actually a disease process, which, as I mentioned before, isn't just necessarily rheumatologic. It can be also infections. In much rarer cases, malignancies can cause these differences. So there's a number of things, but you need a good physical exam in order to look and see if there's anything that's different, because you really shouldn't have growing pains in one leg and not the other, because that suggests that there's a disease process. Growing pain should really affect both legs equally. And as we come to that, growing pains generally affects the lower extremities. So your legs, in terms of your hip, you can get it in your hips, Anywhere in the legs, quite often kids get it in their shins, but it can be anywhere in their legs. But for them to truly be growing pains, they have to be gone by morning, and there can't be any signs of it. So any child that is limping in the morning, or has swelling in the morning, or has even pain going on throughout the day does not have growing pains by definition, and which means it should be investigated further by the child's regular doctor, and if appropriate, referred to a pediatric rheumatologist for further evaluation. So, any other questions that we have from the panel?
I guess you've covered distinguishing it from juvenile arthritis, and so what should a parent do if the parent gets this diagnosis from the child's pediatrician and they're still concerned? What would be the next step?
Well, that is a good question. So the first thing that you can do is just, if you get this diagnosis, is just kind of do a checklist. Does this just happen at night? Another historical fact is it often happens more after a child has been more active than usual, more busy. Is there any signs of any swelling, redness, any signs of injury? And is it gone by morning? And can just rubbing it, massaging it, giving a little bit of ibuprofen or Tylenol cause it to resolve and the child get back to sleep? If that's not true, or if the child has a fever, that's not growing pains. So there's other things, even like viral infections that can cause joint pain. But what distinguishes it is really that there's nothing else going on. And so some people would call it a diagnosis of what we call exclusion, where you've excluded other things that could be going on that's causing it. It can be seen that way, but if you go through the checklist and see that it doesn't affect the child any time except for at night time, it's gone by morning, there's no swelling or any abnormalities that you can see in the legs, and if labs were checked, that they're normal, and if x-rays have been done, that they're normal. But again, you don't necessarily have to get x-rays or labs if everything else is normal about the child and they fit the diagnosis of growing pains. The problem comes is when they don't fit the diagnosis of growing pains, and they are given the diagnosis of growing pains. Then you should bring it to your child's doctor's attention that you're concerned about the fact that your child doesn't truly qualify for this diagnosis, and ask them to do further investigation.
So a final question, why does any of this matter?
It matters because historically, kids before pediatric rheumatology became more of a well-defined subspecialty in pediatrics. A lot of kids that had joint pain, it would be dismissed as growing pains, and when in fact it could be any number of things. So kids sometimes had a large delay in diagnosis for other things, not just juvenile arthritis, but sometimes it can be a malignancy or infections or congenital abnormality that wasn't detected before. All of these things are things that a pediatrician needs to look at carefully and will evaluate. So if your primary care doctor you confront them about this and they disagree, then it's always okay to get a second opinion for your child.
Okay, thank you very much, Dr. Lowe.
Have a good afternoon, everybody.
Bye.